Hello friends, if you or someone in your family has Medicaid, there is a new rule coming that is already being repeated in a very confusing way. You may hear one headline that says, Medicaid work requirements are coming. Then the rumor version starts. Seniors are going to lose Medicaid. Everybody on Medicaid has to work 80 hours a month. Medicare people will have to prove work hours. That is not the full truth. The new Medicaid community engagement requirement is real. The 80-hour monthly requirement is real for certain people. The notice process is real. This does not apply to every Medicaid user, and it does not apply to people who are entitled to or enrolled in Medicare. That one detail can stop a lot of panic. Many older Americans are connected to Medicaid in some way. Some have Medicaid helping with long-term care. Some have Medicaid helping pay Medicare premiums or other costs. Some families have a parent on both Medicare and Medicaid, while a younger adult child, caregiver, or disabled relative may be on Medicaid-only. When all of those situations get mixed together, the headline becomes scarier than the actual rule. So before you panic, before you ignore a letter, and before you tell a parent or neighbor the wrong thing, listen carefully. This video is about who may be affected, who may be exempt, what the 80 hours can include, why your state Medicaid notice matters, and what you should write down before calling your state Medicaid office. This is very important. CMS created the federal framework, but your state Medicaid agency is the office that will send notices, verify records, explain reporting steps, and handle exemptions or hardship exceptions. That means you need both the federal rule and your state instructions. Before we get into the list, if you are not subscribed yet, hit subscribe and turn on the bell. Rules around Social Security, Medicare, Medicaid, taxes, and senior benefits change quickly, and most people are never personally walked through the details. Break these updates down in plain English so you can check what applies before a deadline passes. Now let's start with the biggest misunderstanding. Number 1. This is Medicaid, not Medicare. Medicare and Medicaid sound similar, but they are not the same program. Medicare is generally the federal health insurance program many people use when they are 65 or older, or when they qualify earlier because of disability or certain medical conditions. Medicaid is a federal and state program for people who meet income and eligibility rules. Medicaid details can vary by state because each state runs its own Medicaid program within federal rules. The new community engagement requirement is connected to Medicaid eligibility for certain adults. It is not a new Medicare work requirement. It is not saying people enrolled in Medicare must prove 80 hours of work to keep Medicare. It is not saying every older American with a Medicare card must report work hours. The affected category is narrower than that. The rule applies to certain non-pregnant adults between ages 19 and 64 who are not entitled to or enrolled in Medicare and who are eligible for or enrolled in the Medicaid adult group or certain Section 11(15) demonstration groups that provide minimum essential coverage to adult beneficiaries. It's a mouthful, so let's translate it. For many viewers, the first question is not simply, do I have Medicaid? The better questions are, how old is the person? Are they enrolled in Medicare? Are they pregnant or in postpartum coverage? What Medicaid category are they in? Do they meet an exemption? And what does the state Medicaid agency say in writing? If someone is 70 years old, enrolled in Medicare, and also receives Medicaid help, do not automatically assume this work requirement applies to that person. If someone is under 65 but already enrolled in Medicare because of disability, that Medicare enrollment also matters. And if someone is 60 on Medicaid only, not yet on Medicare, and in the adult Medicaid group, that person may need to pay close attention when the state begins sending instructions. Number 2, your state matters, but do not assume your state is automatically outside the rule. This is where the wording must be careful. This new requirement is not just an old rumor about a few experimental state waivers. CMS issued an interim final rule to implement a federal statutory requirement for certain adults in Medicaid. CMS says states generally must implement the requirement no later than January 1, 2027 for the applicable populations. But that does not mean every person in every state is affected in the same way. CMS says the rule applies in states that cover the relevant adult group or certain covered Section 11(15) demonstration populations. U.S. territories are not subject to this law. States also have implementation responsibilities and some choices around timing, outreach, verification, and hardship exceptions. So here is the plain English version. Do not panic because you saw one national headline. But also do not ignore this because someone online said, my state probably will not do it. The correct answer is found in your state Medicaid notice, your state Medicaid website, by calling the state Medicaid office. States must identify who is and is not subject to the requirement. They must verify compliance for applicable individuals. They must provide outreach and notice. They must explain what happens if compliance cannot be verified, and they must submit data to CMS. That is why the safest message is not, "This affects everyone," and it is not, "This affects nobody in my state." The safest message is, check whether your Medicaid category, age, Medicare status, and exemption status place you in or out of the affected group. Number 3, who may actually be affected. The main group to watch is certain adults ages 19 through 64 who are not pregnant, not entitled to or enrolled in Medicare, and are enrolled in or applying for Medicaid through the adult group, or certain similar Medicaid demonstration coverage. For families, the simplest way to think about it is this. This is mainly about some working-age adults on Medicaid, not every person who has Medicaid. Let's use simple examples. A 62-year-old adult has Medicaid through the adult group, is not on Medicare yet, and does not meet an exemption. That person may need to follow the new community engagement instructions from the state. A 70-year-old widow has Medicare and also receives Medicaid help with certain costs. That is a different situation. This new rule is not a Medicare work requirement. 45-year-old Medicaid beneficiary cares for a disabled family member. That person should not panic, but they should check whether a caregiver exemption applies and what proof the state may request. A 58-year-old with serious health problems may need to ask whether they are considered medically frail or otherwise have special medical needs under the state process. That is why adult children helping parents should be precise. Not just ask, does mom have Medicaid? Ask, is on Medicare? What Medicaid category is she in? Did the state send a notice? Does the notice actually say she is subject to community engagement, or is it just general information? Number 4, what does the 80-hour requirement mean? For people who are actually subject to the rule, the requirement is generally 80 hours per month of qualifying activities. But that does not only mean a traditional full-time job. This is another place where scary headlines can mislead people. Qualifying activities can include work, certain work programs, community service, or being enrolled in an educational program at least half-time. Some people may be able to combine activities to reach 80 hours. CMS also describes an income pathway based on monthly income that is at least 80 times the federal hourly minimum wage. 2026, CMS described that federal calculation as $580 per month. But do not build your plan around one number from a video. Many states have different wage laws for jobs, and your state Medicaid agency will be the place to confirm how the federal Medicaid income pathway is verified and what proof is accepted. One person might meet the rule through paid work. Another might meet it through community service. Another might meet it through a work program. Another might meet it through education. Another might meet it through a recognized income calculation. But the key is proof. Do not guess that your activity counts. Ask your state Medicaid office exactly what counts in your state, how to report it, whether the state can verify it electronically, and what documentation you should keep. Write this question down. What activities count for Medicaid community engagement in my state, and what documentation should I keep? That is much better than asking a vague question like, am I okay? Number 5, exemptions are not a side issue. They are central. This is the section that can protect people, but only if the exemption is identified correctly. CMS lists groups that may be exempt or treated differently under the requirement. These include people who are pregnant or eligible for postpartum coverage in their state, people who are medically frail or have special medical needs that significantly impair their ability to comply, parents, guardians, caretaker relatives, family caregivers of a dependent child age 13 or under, or a disabled individual, American Indians and Alaska Natives, former foster care youth, veterans with a total disability rating, participants in drug or alcohol rehabilitation or treatment programs, certain inmates of a public institution, and some people who meet TANF work requirements or are in a SNAP household and are not exempt from SNAP work requirements. That is a long list, and it proves the main point. Do not believe anyone who says this rule is automatically the same for every Medicaid recipient. A person might be in the age range and still be exempt. A caregiver may not realize their caregiving role matters. A disabled person may not realize that medically frail or special medical needs may matter. A person in postpartum coverage or treatment may not know their status is relevant. Here is the warning. Do not assume the state already has every fact correct. Some facts may already be in the state system, like age or Medicare enrollment. Other facts may not be obvious. Caregiving status, medical frailty, treatment participation, and hardship situations may require documentation. So your job is simple: identify your category and keep proof. Keep copies of Medicaid letters. Keep medical documentation if a medical exemption may apply. Keep caregiver paperwork if your state asks for it. Keep school records if education is how you meet the rule. Keep pay stubs if work or income is how you meet it. And keep a written note of every call, including the date, phone number, and what you were told. Number 6, the Medicaid notice is not junk mail. This may be the most practical part of the whole video. A state Medicaid notice may not look dramatic, not say urgent in huge red letters. It may look like a routine renewal notice or a general Medicaid update. But if it includes words like community engagement, work requirement, verification, renewal exemption, notice of non-compliance, or failure to verify, you need to read it carefully. CMS says states must conduct outreach before implementation for adults already enrolled who could be subject to the requirement. States must also continue outreach for applicants and people going through renewals after implementation. If a state cannot verify that someone met the requirement, the state must send a notice and give the person 30 calendar days to show they meet the requirement or that the requirement does not apply to them. That 30-day response window is one of the most important parts of this entire update. Do not wait until the last few days to open the envelope. Do not assume a family member handled it. Do not assume I am exempt means I can ignore the letter. If the state asks for information, respond through the official state process. If you help an older parent, spouse, neighbor, or disabled relative, ask them directly. Have you received any Medicaid letters? Create a folder labeled Medicaid Notices. Write the date received on the envelope. Keep copies of anything sent back. If you upload documents online, save a screenshot or confirmation number. If you call, write down the date, time, phone number, and the name or ID number of the person you spoke with. Number 7, hardships exceptions may matter, but they depend on state choices and rules. Some states may choose to offer short-term hardship exceptions. These are not automatic for everyone. They are specific situations that may allow a person to be considered as meeting the requirement for a month. Examples can include receiving certain medical services, such as inpatient hospital or nursing facility services, living in a county affected by certain disasters or emergencies, living in a county with a high unemployment rate, or traveling outside the community for serious or complex medical care for yourself or a dependent. This matters because many families are helping someone who is not yet on Medicare, but is dealing with serious health problems, unstable work, caregiving, or medical travel. Hardship may apply. Do not just say, I had a hard month. Ask the Medicaid office. Does my state offer short-term hardship exceptions for the Medicaid community engagement requirement, and how do I request one? Also ask, what proof do I need and how long does the exception last? Number 8, watch for scams that use the new rule to scare people. Anytime a government rule gets attention, scammers move fast. You may get a phone call, text, email, or social media message saying your Medicaid will be canceled unless you click a link, pay a fee, or give your Social Security number. Be careful. State Medicaid offices may contact people through official channels, but a random caller demanding your Medicare number, Medicaid number, Social Security number, bank account, online password is a red flag. Do not pay a Medicaid work requirement processing fee. Do not give your Medicare number to someone who says they can fix the Medicaid rule. Do not click a text link just because it says your benefits will be suspended tonight. If you are unsure, hang up and call the official number from your state Medicaid agency, your state Medicaid card, or a notice you have already verified. Agencies send notices. Scammers demand secrets. Number 9, here are 3 simple situations. Mary is 72. She has Medicare and receives Medicaid help with certain costs. She hears Medicaid recipients must work 80 hours and she panics, but Mary is enrolled in Medicare. Her first step is to read any Medicaid notice carefully, confirm her Medicare status is reflected correctly, and call the state Medicaid office if a notice seems wrong. Robert is 60. He has Medicaid through the adult group and is not on Medicare yet. He works part-time, but his hours change. Robert should ask what counts, what proof to keep, whether income can satisfy the rule, whether he has any exemption, and when his state will begin verification. Is 54. She has Medicaid and cares for her disabled brother. She should not assume she will lose coverage. She should ask whether caregiver status is an exemption and how her state documents it. 3 people, 3 different answers. This rule is real, but the rumor version is too broad. Here is your short checklist. First, check Medicare status. Second, check age. Third, check Medicaid category. Fourth, check exemptions. Fifth, read every state Medicaid notice. Sixth, keep proof before you need it. Seventh, call the state Medicaid office using an official number if anything is unclear. And eighth, never give personal numbers or banking information to a random caller, text, or website. That is the safest way to handle this rule. No panic, no guessing, no ignoring mail. If you help someone older, disabled, or overwhelmed by paperwork, sit with them for 10 minutes and look through their Medicaid letters. One clear folder and one phone call can prevent confusion from turning into lost coverage. Subscribe for more plain English updates like this, and share this with someone on Medicaid, Medicare, or someone helping an older parent. This is exactly the kind of rule that gets distorted online, and one clear conversation can stop a family from panicking or missing an important notice.